This is a presentation on why the creation and implementation of safe consumption sites is a good thing. What are safe consumption sites? Safe consumption sites are places that provide a safe, clean space for people to bring their drugs for personal use in the presence of trained staff. This is a good thing for communities dealing with the opioid crisis. They can help those using such substances not to use contaminated substances and risk an overdose. Public opinion is a large problem regarding safe consumption sites, as is a thing that affects the communities that these sites are in. Um, this issue varies from city to city and from country to country. In Canada, they are legal, but in the United States, they are technically illegal. Many surveys have been done on the issue of SCSs, but in two different surveys, one from Canadian views and the other from Americans, they came to two different conclusions. In a study by McGinty et al. In Preventive Medicine, the national survey resulted in low support for safe consumption sites at 29%, and support for syringe services at only 39% support, which is very low in terms of support, despite the benefits this would have to the communities. Whereas in a study by Berrigan and Zucchelli in Drugs and Alcohol Dependence Journal found that Canadians are more in favor of discrete choices for SCSs. As a result to the survey were affected by concerns if this SCSs was a higher cost than the healthcare system, the SCSs were located in the respondent's neighborhood. As well, the number of discarded needles in the respondent's neighborhood were more chosen than other options, with more support for the SCSs if it improved the neighborhood in their view. This shows that people do care about their neighborhoods and will accept safe consumption sites. In 2017, during the continuing opioid crisis, Health Canada approved safe consumption in Surrey, BC, where supervised injection, oral, and intranasal consumption is allowed. Between June 8, 2017 and May 6, 2018, there were 55,554 visits to the SCS by 1,480 unique clients, and there were 577 overdoses managed. This shows how the SCS has helped those in needing communities where help is needed. The site also provided harm reduction applies to those at the site, regardless of whether or not they were using the site to consume substances, allowing for those affected to have resources in the community. Safe consumption sites are places people are going to for support in order to use in a safer space than on the street. In a research paper from 2020 from the Drugs and Alcohol Dependence Journal, researchers looked at the relationship between safe consumption sites and those using an intensive social connectedness and community. From conducted interviews from their research, it was determined that safe consumption sites had unique benefits for people experiencing homelessness. By providing a safe place to inject drugs, SCS were perceived to protect against drug use-related criminalization and emergency shelter bans. Given that unsheltered homelessness is associated with higher mortality rates than sheltered homelessness. This means that those that are homeless now can now not be kicked out of their shelters for drug use, as they have a place to do it safely instead of in a packed shelter where support may be less than amicable. As well, a study on the impact of unsanctioned SCS in Philadelphia on criminal activity in the surrounding area saw a decrease in interpersonal crimes during the time that the SCS was in the area than before and after. As seen in the line, the Davidson et al. Study found the following. On average, interpersonal criminal-related reports in the post-intervention period steadily decreased at a similar rate per month than within both the intervention area and the control area 1. However, the change in rate of discipline of post-intervention was significantly greater in the intervention area compared to control area 1. Therefore, this represents the good the SCSs can do for the community, as the community saw a decrease in crime, because those that were committing crimes before now did not need to commit crimes, as there was a safe place to use their illegal substances. Less people were likely to be stabbed, murdered, or robbed. That is why the creation and implementation of safe consumption sites is a good thing. These are the sources. Have a lovely day.